Hello guys, today's our topic is all about the clinical classification of fungi. So this classification of fungi are divided into two types. One is the superficial fungal infection and other one is the systematic or deep fungal infection. Superficial fungal infection means the infection which occurs on the outer layer of the skin, nail and hairs, called the superficial fungal infection. Systematic fungal infection or deep fungal infection means the infection which occurs in the internal organs of our body, that is called the systematic fungal infection. So guys, now I am telling about the superficial fungal infection first. So superficial fungal infection is divided into two types. One is the superficial mycosis and other one is the subcutaneous mycosis. So superficial mycosis is again divided into the superficial and subcutaneous mycosis. So these are the fungal infections which occurs in the superficial. Super means the uppermost layer of our skin. Like this is the tinea nigra. Tinea nigra means the infection which occurs in the uppermost layer of the skin. This is called the tinea nigra. Guys, now I am just telling the name of the fungal infections. In next video I will explain in details about each fungal infection like tinea nigra, pityriasis versicolor. In next video I will discuss about the like tinea nigra, about the distinguishing features, diagnosis of the fungal infection, treatment, pathogenesis. These all I will discuss in next lecture. So first I am telling about the superficial mycosis. This tinea nigra, pityriasis versicolor. Pityriasis versicolor means the skin infection which is caused by a type of yeast, and white pityra, black pityra. White pityra means this is the uncommon yeast infection of the hair. Black pityra is the infection of the hair shaft. And onychomycosis is nothing but the superficial mycotic, and this infection occurs in the outer ear canals. So guys, now I am going to shift in other types. The cutaneous. The cutaneous is occurs in the dermatophytes. Means the cutaneous is divided into the dermatophytosis, and in dermatophytosis, the dermatophytosis again subdivided into the three types. One is the epidermal dermatophytosis, other one is the dermatophytosis of nails, and the dermatophytosis of hair and hair follicles. So first these are the fungal infections which occurs in the epidermal dermatophytosis. Epidermal means uppermost layer of the derma means skin. The infection which occurs in the uppermost layer of the skin called epidermal dermatophytosis. So tinea corporis, tinea pedis. Tinea pedis is also known as the athlete's foot. Tinea manus, tinea cruris. These all are the fungal infections which occurs in the epidermal dermatophytosis. Dermatophytosis of nails. These fungal infection like tinea unguium and onychomycosis, these comes under the under the types of dermatophytosis of nails. And here this is the tinea capitis and Mazzocchi granuloma. This fungal infection comes under the dermatophytosis of hair and hair follicles. So guys, here now I am going to tell about the subcutaneous mycosis. So subcutaneous mycosis is divided into 4 types. One is the mycotoma. This fungal infection occurs in the subcutaneous mycosis, like mycotoma, sporotrichosis, chromboblastomycosis, pheohyphomycosis, pheohyphomycosis. These are the fungal infections which occurs in the subcutaneous mycosis. Subcutaneous means the infection which occurs in the skin, subcutaneous tissue, and some other underlying tissue and organ of our body. That is called the subcutaneous mycosis. Means subcutaneous means below the superficial fungal infection. So this is mycetoma is further divided into three types. One is the eumycetoma, actinomycetoma, botryomycosis, mycosis. These are the types of the mycetoma. So now guys, I am going to shift in other topic, like other types like systemic or deep fungal infections. So systemic or deep fungal infections, I already told, this is the internal organ infections. This is divided into 2 types. One is the primary systemic and other one is the systemic opportunistic mycosis. So primary systemic mycosis, these are the fungal infections and fungal's name which is comes under the primary systemic, like histoplasmosis. Histoplasmosis is the fungal infections which comes under the primary systemic mycosis, like coccidiomycosis, blastomycosis, paracoccidiomycosis. These 4 are the fungal infections which come under the primary systemic mycosis. This histoplasmosis is caused by the fungus called Histoplasma capsulatum. This coccidioidomycosis is caused by the coccidioids imitates. Blastomycosis is caused by the fungus called Blastomyces dermatitis, and paracoccidioidomycosis is caused by Paracoccidioids brasiliensis. These are the fungus which causes this type of fungal infections. So now guys, I am telling about the systematic opportunistic mycosis. So systematic opportunistic mycosis are divided into these are the fungal infections which comes under the systematic opportunistic mycosis, like candidiasis, cryptococcosis, aspergillosis, zygomycetes, pneumocytosis, and penicilliosis. These are the fungal infections which comes under the systematic opportunistic mycosis. So guys, these are the clinical classification of fungi. I discuss is all about in this lecture, all about the clinical classification of fungi. So in next lecture I will discuss one by one about the all types of fungi, like histoplasmosis. About histoplasmosis I will discuss how the histoplasmosis occurs, where findings like what is the distinguishing feature of histoplasmosis, what is the transmission factors, what is the reservoir, what is pathogenesis, diagnosis, and treatment, prevention of the histoplasmosis. So in next lecture I will discuss all about the fungal infection in details. So guys, I hope you like my videos, so please like, share, and subscribe my video so you can get the next lecture update. Thank you so much.